subjective and objective assessment for the Better Back program. Firstly, we're going to run through the subjective assessment, and I'm going to explain what I'd be looking for in a history of a client, and then we'll run through the objective and we'll use Paul as a model and go through each individual part of that assessment. First of all, you'll see on the form, and I'll show you this later on, name, assessor and trainer. Trainers are important because then you can liaise with the personal trainer about that person's condition and show them, especially if that trainer is inside that treatment session. Date of birth, date, standard. The GP referral is also important, you need to get that down, and the surgeon, especially if they've had any back surgery. We have a park here on the right hand side here for you to complete if you are concerned that person needs to has medical problems and needs to fill in a questionnaire prior to any exercise. So first thing to do, with a standard form, start with the current history. When you sit that person down, they're most likely just going to rattle off and start talking about things, and you can just put it in wherever, whatever they say, you can start putting it in. Some people are very quiet and they need prompting to what you're going to ask for. So therefore there's a lot of prompt cues on this sheet. I first ask what their present symptoms are. I'm basically saying, when they put on their new patient form, they'll say back problem, tell me about your back problem. I always say things like, tell me about this, tell me about that, what happened, that sort of thing, what pain are you in, what do you feel. They'll give you, start rattling off usually a blurb of what happened to them or what they're feeling. So present symptoms are the first thing. What I'm looking for here is pain, number one, and stiffness, number two. But also any other sort of symptoms they are feeling, whether they may describe it as dull ache or sharp pain or tightness, or I feel weak, or I'm having weird pains or weird sensation problems, and you write all that down. Also got a visual analog score out of 10. Again, that's very important to start. Where are they based at 10, and what are they basing their pain on? If they say, oh, it's 11, you know that they may be an over-exaggerator, because obviously if they say, oh, it's 11 out of 10, bring them down a bit and say, well, usually when we ask people, a 2 is about a headache, and an 8 is pretty much a hot poker through the eyeball, and 10 is childbirth, if you can explain that sort of one to them. Then they may go, oh, okay, it's around about a 7 or a 6 or something like that. Now, if they're saying a 7 or a 6, you may have to sort of, at that point, realise that they're in a lot of pain, and you may not be able to do the entire assessment. It's not appropriate sometimes to do the entire assessment in that session and use up a whole hour just on assessment and then not treat them. If an acute patient comes in like that, that's why I've got it there starting off. You're better to try and get as much issues down as you can so you can do a proper objective assessment and treat them correctly without any red flags or yellow flags, and then to treat them and assess them, and then once you've got the pain down, you may be able to assess them further